Moving on, we have our next keynote presentation, and I'm sure all of our participants are waiting for, is by Dr. Khalid Alyafei, right? Dr. Khalid Alyafei, Chief Medicine Informatics Officer and Senior Attending Physician, Emergency Medicine, Sidra Medicine, and his keynote speech is on experience about virtual consultation and telemedicine. We welcome you, Doctor, and the stage is all yours.
First, I want to thank you for having me to join Qatar Telemedicine Technical. And I think this is something is important that what we discussed today, and it is an honor for me to be joining my colleagues today in that discussions. And since this morning, I'm enjoying all the discussion that's happening so far. So just to speak about telemedicine or telehealth in general, and also to share some input about what is happening here in Qatar. As we know, telemedicine or telehealth is a technological communications tool, and it has been evolved from like last centuries. This communications tool is available for us, and even it had been like discussed before even 1940, and it continues to be improved with time, especially after the discovering of the internet in 1990. It had been used mainly for consultation, especially to serve the people in the rural villages. So telemedicine technology is available, but in my opinion, it is still underutilized, especially here in Middle East. However, we learned a lot during past 2 years during the COVID-19. We can see how this technology's demand increased to provide remote care to the patients who they cannot or unable to come to the hospital physically, and also to be comply with the government, like regulation to reduce unnecessary visits, to reduce, like spreading of the infections. So the only way to provide the care is by utilizing the telemedicine. So the demand was very high in the last 2 years. So telemedicine has supported other services, as we know, such as consultation, business meetings, educations, research, and others and others. It is really what we found in the past 2 years. It is a reliable tool. It helped us to continue to provide an excellency care. Even it helped the medical team to provide the care to their patients on time, and it reduced the travel time, expenses, and the tool can also assist to do the remote consultation for those patients by establishing the communication link between the primary doctors and their patients, and with any expert consultation from distant medical centers. Now, wherever the patient's locations, even in rural areas or in your cities, the care consultations level still can be provided by using these technologies. So as we can see, the telemedicine has enhanced medical care through a faster and accurate assessment than can be delivered by telephone consultations. Because during the past 2 years, we had some doctors who they prefer to utilize telephone consultation, and we promoted the video consultation because that gives the doctors better and more information to be able to serve and provide the care. So the physicians, so this is something new that we had in the past 2 years. So to change those behaviors and to improve the adoptions for both perspectives, patients and also the physicians, it's required time. And we learned a lot in the past 2 years about the benefit of telemedicine. So the physicians are the accountable persons at the end of the day to decide about the type of communications tool to conduct their consultation visits. We are required to understand that telemedicine doesn't replace the in-person visits, but it is actually added value that augment the care. It involves establishing a link to communicate with the patients, and also it helps to support, like personalized medicine, where the patient now is empowered that he can schedule himself for the care consultations and register for the service, even worldwide. He can do the consult even in different countries by utilizing, having the net connectivity, by utilizing the telemedicine. Also, it's helped the hospital operations by reducing unnecessary visits, reduce crowds, reduce cost, give more chance to other sick patients to come to the hospital, and reduce the travel time. So we found from our experience that telemedicine, telehealth, it's helped also in educations, virtual conferences, researches, and also in business meetings. So it adds a lot of value to us. And now, as we have, like the COVID-19, now it's reviving or it's subsiding. Now the patients are returning back to in-person visits, but still we continue utilizing telemedicine to support some of the services like mental health and some of the consultations, especially for the people or the patients who they are living outside the country, or for the patients who are chronic and they don't like to come physically to the hospital when it's not needed to have a physical exam or any investigations. They can conduct the care through the telemedicine. So in general, I feel like telehealth, telemedicine, it's an evolving technology that is easy, can be integrated with other technology like health information exchange, medical records, mobile health, and remote monitoring. So having that all together to enhance the interoperability by utilizing this telemedicine, I think it will add a huge value in the future to improve the medical care, especially in Qatar, with now we are planning now to host the World Cup 2022, and also to support our like a strategy for the visions for 2030. I think telemedicine will be adding a huge value to support that. And despite that, there is some people who they have maybe some fear to use telemedicine because of the HPI, like the health person, like information in terms of the privacy. There is a lot of tools and technology that they are HIPAA compatible and it is reliable. And we approved that in the past 2 years. So in summary, I think telemedicine is a great tool to adopt for health communications. And we recommend that each organizations to develop their own policy, how to utilize telemedicine. And we need to utilize it that benefit both the organization, our patients' care, to maximize its benefits and reduce risk. And having clear policies for checking patient identification and maintaining patient confidentiality. So I think having a clear policy for utilizing the telemedicine in medical care, it will add a huge values and will maximize the benefit, how to utilize it effectively. And thank you. If there is any question, I'm happy to answer those.
Thank you, Dr. Khalid. If we do have any questions, we'll go ahead and send them to you, and hopefully you will be able to answer them. And we will go ahead and convey the answers. And we would like to move on now. Thank you very much. And your presentation was very insightful and informative. And I'm positive our dear participants definitely got lots of information from your keynote. Thank you, Doctor, for joining us, and have a great day ahead.
Thank you.
My pleasure.